Prostate cancer is the most common non-skin cancer in men. It's the #2 killer of men in the United States, the #2 cancer killer of men in the United States. It's an incredibly important disease. 1 in 6 men will develop prostate cancer in their lifetime. So to be able to make better diagnoses and make those diagnoses personalized for each individual man is extremely important. Decatur Memorial Hospital is able to do that utilizing a couple of different GE advanced imaging technologies. This includes our PET-CT, where you can utilize PET tracers as well as get exquisitely detailed imaging of the anatomy for that particular patient. It also includes utilizing MRI. MRI works a little bit differently than CT scan, and it's a little bit better at differentiating between certain different kinds of soft tissue. Therefore, MRI may be extremely important in certain men to help determine whether or not they have prostate cancer and the extent of their prostate cancer. Decatur Memorial Hospital is able to create a bunch of different radioisotopes. This is important because each individual patient may need a slightly different imaging technique in order to evaluate their particular condition. This could range from nuclear medicine conditions, where you might be looking to see if somebody has heart disease, to looking for different kinds of cancer, to even looking for certain neurodegenerative disorders. Because Decatur Memorial Hospital has GE's cyclotron as well as GE's Fast Lab, it enables them to be able to develop a good breadth of different potential radioisotopes.
C11 choline PET imaging is the best and latest test for detection of prostate cancer. Up until recently had been used almost exclusively on a trial basis for biochemical recurrence of prostate cancer, and is now kind of gaining more widespread use for detection of prostate cancer in general. And the earlier you can detect the prostate cancer, the changes different treatment modalities, and the earlier you can detect it, the better chance there is for long-term cure.
If a man has a rising PSA, but it is still very low, that is around a level of 2, normally on conventional imaging we wouldn't be able to detect where the cancer is located. But with C11 choline PET technology, we are able to identify where the relapse is located. The C11 choline is concentrated selectively in prostate cancer cells. And so you end up on the PET image with a bright spot where the C11 choline is concentrated. But our initial analysis indicates that there is about a 30% increased detection rate of prostate cancer over conventional imaging. This has the potential to change the paradigm for treating relapsed prostate cancer.
71-year-old retired physician. I had prostate cancer first found in 2007, and the cancer was removed with a radical prostatectomy. And then I've been PSA free, or 0, since then until last year when it just barely started to rise. This spring it was up to 0.29. I myself wanted a little more evidence. I wanted a little bit of proof. And so I started researching this, and I found Decatur Memorial Hospital had a PET choline scanner, and so I called. And I said, if it's there, I'm going to go find it and do it. The results are gone over personally with the imaging radiologist in a personal consultation room with a big screen, which makes it easy for lay folks and people like myself to see and understand and see what's going on, so that your results can be pointed out to you and then taken back, because you're given a disc to take with you back to your physician, then can review the results themselves. It was just a very satisfying experience. It was easy to get here, it was easy to make the connections and get this done.
I could have chosen to go to some of the major facilities that we had the finance to do that, to go to, but we chose Decatur. I think it's one of the best kept secrets in the area of cancer research in the heartland of America. And we always look for other places to go to, and right in our backyard, we have an exceptional facility, first class. The technology, of course, I think is just through the roof. Cancer, of course, is a huge thing to deal with, both psychologically and physically. And when my wife and I, we looked at it, we chose Decatur Memorial Hospital. We chose the Cancer Center here in Decatur. And from that, what has happened and transpired has been nothing less than phenomenal. There is one individual that really stood out, Roel Villanueva. Powerful. He says, Mr. Harper, I'm going to treat you as I was taking care of my very own dad. I'm going to treat you that way. That resonated with me in a powerful way. I knew I was in good hands, not just with that statement, but the care that I was receiving, and the technology was just awesome.